My name is Martin Voss. I'm a GU medical oncologist at Memorial Sloan Kettering Cancer Center in New York. And I was the fortunate recipient of the Young Investigator Award in 2012 when the KCA sponsored a project I was working on at the time as a research fellow. Yes, so at the time, 2012, going back a long time, we had a different treatment landscape for metastatic kidney cancer. This is before we had immunotherapies, and we're very focused on various different targeted strategies. And one of the mainstays of care at the time was treatment with targeted mTOR inhibitors. Those are still available to our patients today, but they're used less now because we have newer agents. But at the time, we were trying to parse out how it was that some patients benefited greatly from these agents while others didn't. And I had a project at the time looking back at outlier responders to mTOR inhibitor therapy. So those were patients with metastatic kidney cancer who had been treated at our institution, Sloan Kettering in New York, and had had unusual benefit from therapy, either very deep responses or had been on the same agent for extended periods of time. And we wanted to look at tumor tissue from these patients and try to understand if there were any type molecular signatures, genomic alterations that might predict why they responded so well. So for me, this was an important project. I had just started to do clinical translational research in kidney cancer, and this was my first investigation collaborating with folks in the lab intensely. So I looked into these things together with laboratory investigators and pathologists at my institution, and I forged some very important collaborations. And born out of this, because we did find a signal in extreme responders, I was able, through my clinical mentors, to take this to the next level and look at the question together with industry on clinical trial data sets. So larger data sets of patients treated with this category of drugs, again, going back into tumor tissue and trying to understand who doesn't respond, which, for me has remained an area of interest. So I do a lot of research still, now looking into other questions for other drugs with laboratory investigators at my own institution and elsewhere. And I have, through the years, always fostered relationships also with industry partners looking at archival tissue samples from trials that they have collected in the past of accruals. I think this is a theme that's important to us in the field. I think projects like these are so valuable to junior investigators, mentored fellows. That was my position then. And then also folks that start to form their own independent careers as investigators. I think the KCA support to that helped me a great deal. It gave me support, salary support. It gave me a platform. I remember this very fondly. I presented that data at one of the IKCS meetings at the time, and people from other institutions came up to me afterwards to ask, so gave me networking opportunities. And it also, put me on track to think about ways to apply this on clinical trials, including, some investigations, trials that we wrote ourselves. I would say, keep up the good work. It's, it's arduous. It's a lot of, time that goes into projects like these, but I do firmly believe that it moves the field forward. Within kidney cancer land, it may be in a greater area of need in some areas than in others. I personally have been very interested and invested in rare kidney cancer variants, and I think there's a lot to be learned exploring the unique biology of different kidney cancer subtypes and understanding what therapeutic applications might apply to one versus the other subtype. And I do think that it all starts with work at the bench, ideally using patient samples, human tissues from tumors and metastases. And I think there's grant opportunities, with the KCA that help support important work like that. And that can really help, spark new projects, ideas, angles, and ultimately, ways to help our patients. Yeah, if I just think about the conversations I've had over the last, 24 hours here at the meeting, I do know that that advocacy groups play an important role in what we do as clinical trialists and kidney cancer docs. I do think they give us unique perspective in terms of endpoints that are relevant not only to us, but also to patients. There's sessions here that we've had about this. I do think when we talk about rare indications in kidney cancer and ways to actually make biology-driven novel investigations into therapeutic strategies reality, I doubt that we would be able to do it without the support of advocacies, communities to sort of help connect patients and docs about things that, we are striving towards. And again, if I think back to, how we were having conversations then versus, now, 2012 versus today, I do think that they have a greater role and they're of greater help to us than they were before, because we've all learned together on how to do things better. I think, just in the context of this conversation, if I think back to the work I was doing when I was getting started in kidney cancer land in 2012, I've been very fortunate just to witness a great degree of change for the better and an ever-growing list of approved agents in this cancer. It's very hard to put into a few words how different it is to treat metastatic kidney cancer today compared to 2012. And at the time already, kidney cancer was a model for novel drugs and targeted applications of cancer therapeutics. That trend has only continued, and I think there's a lot to be hopeful about for our patients. Seeing the conversations at every IKCS meeting like the one here. Talking to my colleagues about all the exciting things that they are doing on their own clinical trials, on trials that we are working on together. One thing that, is very clear, I think, to anyone here, is that there's a lot of energy in the room and a lot of opportunity, lots of press releases recently about positive, phase 3 trials and conversations about how our landscape may yet again change. And to me, back in 2012, there was a pressing research question for therapeutics that I thought, were super important at the time and were like a big part of what we were doing. And since then, we have multiple agents that are even better than those drugs were. And we are now asking, interested questions about those newer agents. I think, I'm excited to see, what's next. I'm always interested to work on new projects with my colleagues in pathology, surgery, in the lab, and with the KCA.